You're going to hear a lot in this campaign about the things each candidate will do for you and our country. But what you need to hear is the truth about the most urgent challenges that confront Britain in the months and years ahead, and what we're going to do to fix them. I've seen the situation firsthand from the inside of government, and I can tell you with all honesty, there are several key ways in which the system simply isn't working properly. Our country faces some of the biggest challenges any of us will have seen in our lifetime. And these challenges aren't abstract or down the track. They're staring us in the face. Every family worries about getting the NHS care they need for themselves, their parents, grandparents, or their children. I pledged at the start of this campaign to tell it to you straight, and that's exactly what I'm doing. Because a return to business as usual won't cut it. The same old promises won't cut it. People may not want to hear it, but they need to hear it. So my government will be unlike any other you have seen before. From day one, we will move on to a crisis footing and focus relentlessly on 5 massive emergencies facing our country. Over the coming days, I will set out each of these 5 emergencies and how I will grip and resolve them. And I want to start with our biggest public service emergency, the massive backlogs in the NHS. Waiting times for everything from major surgery to a visit to the GP are at record levels. Millions of people are waiting for the life-saving cancer screening, major surgeries and consultations. Already, many people are using money they really can't afford to go private. That's privatization by the back door, and it's wrong. People shouldn't have to make a choice with a gun to their head. If we do not immediately set in train a radically different approach, the NHS will come under unsustainable pressure and break. We risk thousands of people needlessly dying as a result of the lack of grip at the centre of government. This would not only be catastrophic for the lives of all those concerned, it would be a moral stain on our nation. I will not allow this country to sleepwalk into the worst NHS winter crisis in decades. And so from day one, I will make tackling the NHS backlog my #1 public service priority. Some people might tell you that the NHS is always stretched, that it's inevitable when we have a comprehensive health service, free at the point of use and almost infinite demand. But this time, it's different. COVID has done huge harm to the health infrastructure of this country. It bled us of resources and created a huge backlog. Some people want to pretend it's all the fault of the government. The truth is that this problem wasn't created by the government, but it is up to the government to solve it. In our hearts, we all know that the aftershock of COVID is the main factor causing the problem. But actually, COVID also points the way to a solution. Britain's heroic response to COVID proves that where the political will exists to really grip a problem, when we treat something as an emergency, we can bring everyone together and win the battle. That takes leadership. So I'll take the best of our experience from COVID and establish at the centre of my government a backlogs task force to support the leadership of the NHS to triage and treat patients quicker. I will get the number of people on the NHS waiting list falling by next year, and everyone who has been waiting over 18 weeks will be contacted by their trust within 100 days of me entering Downing Street. I want to give people peace of mind that this emergency will be gripped. Almost all of you will know someone who is waiting for a treatment they need and deserve, and I will not let them down. I want people to understand that the stakes in this leadership election are very high. The cost of choosing wishful thinking over hard reality is more than most people can possibly imagine. The choice our party has to make is, who do you trust to grip this moment and actually make change happen? I was at the heart of the government's response to COVID. I organised the furlough scheme that other people said was impossible. I found the resources to pay for the vaccine rollout. Now another massive health crisis is upon us. I know I can do it again if you give me the chance.